Hello everybody, my name is Dr. Juiinigudkar and I'm a first year radiology resident in Mumbai. This video is to talk a little bit about the ending of first year, what I have learned over the 1 year of residency in radiology and in residency in general. First of all, I would like to say that to everybody out there who is a little bit skeptical about taking up radiology, my 1 year of residency so far has been decent. It has not been amazing, it has not been horrible, it has been somewhere in the middle, it has been good. I have had the opportunity and the fortune of learning a lot of things. Like, I realize now at the end of first year when I speak to somebody else from some other field of life that I know so much about this one branch already. It's not even the end of my residency yet, it's just the end of first year, and I know so much about ultrasound and I have started to learn so much about CT. Soon I'll be learning about MRI. I'll be learning so much about this one particular thing which nobody else learns about normally, and that is pretty cool. It's one of the things that makes me like medicine so much, is that we know so much about a field that people don't know so much about, and we just have so much knowledge and so much of a grasp over the basic sciences, human body. That is pretty cool to me. So yeah, at the end of first year now, I am very proud of everything that I know, and I am also humbled by everything that I don't know yet, and I am excited by the things that I am yet to learn over the next 2 years of residency. I'm ending the first year on a pretty positive note. Yes, there was a time in between the middle of 2024 where I was really frustrated. Suddenly we were starting to get more responsibilities as a first year. Like, as we were learning more and more ultrasound, we were getting more responsibility for ultrasound. And in a government hospital like the one which I am working in, you have a crazy amount of patients for ultrasound because clinicians will request ultrasound for basically almost everything, and it makes sense because it is a very cheap and amazing tool with high sensitivity to pick up on a wide variety of things, like whether it's GIT, whether it's musculoskeletal, whether it's local. Range of diagnostic variety in ultrasound is very wide. Almost every single branch out there, including derma, is going to want ultrasound for their patients, and they are going to come to you for it every day if you are posted in ultrasound and are on call as well. So throughout the 24 hours you end up doing like 200 scans maybe. And I'm not saying that with a lack of gratitude. Of course, I know that we try and get into government colleges because of this very patient load and because of the fact that every patient you see is a new opportunity to learn. Every case you see turns out to be something rare which you have always just read in your books. There was so much stuff to learn, and 1 year ago, if you had asked me, I had no clue about this. Exactly 1 year ago, I had finished 1 month of my residency and I was still pretty clueless and overwhelmed by everything. Like, how am I supposed to learn all this in just 1 year? And here I am at the end of just 1 year and I know a lot, and that makes me really happy. All the people who want to take up radiology but are feeling skeptical because you don't think it is clinical enough and you are a very strongly clinical person. I used to think that I was a very clinically oriented person and I really wanted to take medicine initially. I thought that the medicine which I read in the books, it would be fun to apply that knowledge in reality, use my theoretical knowledge and see how it plays out practically. I used to think that I definitely need all these things in my life. I cannot do without these things, but I also knew that my reasons for taking medicine were not as strong as other people who wanted medicine. Like, my interest revolved more around the variety of conditions which medicine has to offer. It was more about theoretical knowledge and it was less about me wanting to actively manage a patient. It's less about me wanting to definitely be there in the patient's management course, definitely wanting to stand out in a patient's hospital course. For me, it was more about the diagnostic aspect of medicine rather than even the treatment aspect. And I realized when I was shadowing a physician, it is a lot more complex than that. Sometimes your treatment is not going to work and you will not know why. It will take you multiple years to even get to that experience level, which tells you that even though this is a textbook treatment, it's probably not going to work for your patient. A lot of times you will fail and you will not get the desired result. Your patients are not going to be happy with you. It's going to be really stressful. I was not sure if I was up for that kind of a stress, and I ended up taking up radiology because initially I used to think that it's a pretty non-clinical branch. won't be interacting with patients. I won't be there getting thanked by a patient for treating them. And that is what I thought about radiology. I had made peace with the fact that okay, I will get the kind of life I want to prioritize. I'll compromise a little bit on the gratification part of my career. But after joining residency, I've seen that it is not as non-clinical. Like, I talk to residents from other branches and then they mention a patient to me and I'm like, oh yeah, this patient, I had done ultrasound for this patient, what about it? Then they tell me like, this has been up, we treated him for this, we did that. I get follow-ups for these patients. I ask them whether my pigtails have worked, whether they're draining properly, whether things are going well for that patient. We do biopsies for patients, we ask for follow-ups, whether the sample was adequate, whether the diagnosis has been made. I realized that like my branch actually, like a branch that pretty much ties up everything in the hospital. Like, we are connected with almost every single branch, like right from general surgery to GI surgery to CVTS, cardiothoracic surgery. We are connected like to almost everything, and we know about every rare case and every like chronically staying patient in these departments. We know a lot because they get a lot of scans done. They have multiple CT scans, they have multiple ultrasounds. It is pretty cool to help diagnose the patient's condition and then learn about their management and find out what happened to the patient via your colleagues in these other branches. I have found that it is pretty satisfying. There have also been times when you ease a patient's pain. Like, for example, there was this lady who had come to us when I was on call, and this was just a few days ago. She had empyema necessitans. She had a thoracic empyema which was connecting via a tract in her chest wall, and it was forming a little abscess right here in the subcutaneous plane, and she was having a lot of pain because of it. We counsel the patients whenever we are doing a procedure. We tell them about the nature of their disorder and what we are going to do to help them. I explained to her that her pain is not going to go away just by tapping this little thing. It might even recur because she has a connection with her thoracic cavity and there's already a lot of pus inside there as well. She was just like, I just have this pain here, I need to get rid of that pain. If you can do this painlessly, I will be forever grateful. Being very over the top, of course, but she was in that much pain. And after we did that tap, she was so relieved. Like, she was smiling so hard with like almost tears of joy in her eyes, and that was a nice sight to see. It really got me thinking that I never thought I will be seeing all this in a field like radiology. But here I am seeing this. I am seeing this many times. It's not just a rare occurrence. Yes, there are times when you get into fights with patients, you get into fights with residents. That is just a residency thing, and it persists only for maybe 1.5 years of your hectic years of residency. So far, I have been pretty satisfied in this branch. I have been learning a lot. I have been having a great time. I have been also getting enough free time to meet my friends, to spend time with my loved ones. Albeit this time is reducing as my first year is coming to an end because I don't have juniors. Our third years, like our exam going batch, have been relieved to study for their exams. So there's just 2 batches handling all the work in the department. It is pretty hectic right now. If you are somebody who is confused between radiology, between clinical branches, heavy clinical branch like surgery or OB/GYN, first and the best thing to do is always talking to as many people as possible. Of course, you speak to residents, you speak to people who are post PG, who are just trying to set up their practices, and it's all a new experience for them outside of PG. How is it different from PG? How is the life outside of residency different from residency which they got done with just 1 year ago? You talk to well-established physicians who are already years into their career and who have made a name for themselves in their branch. You need to get their perspective on this branch. You have these different perspectives on this branch, and your choice making is not biased and not influenced by just one stage. Like, if you are scared of doing residency in OB/GYN, that is going to scare you away from this branch. While in fact it may be the best branch for you for the rest of your life. When you talk to older people and you find out that they also had a tough residency, but the work they are doing right now is way more rewarding than they ever would have thought, and it makes residency worth it. When you find this knowledge, it inspires you, it motivates you to go for the branch which you want. So don't just talk to your immediate seniors who are doing residencies right now. Take their advice with a pinch of salt because they are first years probably, and they are having a really hard time, so their advice might be a little influenced by that, but that time is short-lived, that is temporary, and what is forever is the branch you're taking, the kind of work you'll be doing in this branch outside of residency after the 3 years of residency. You have to talk to multiple people to get their perspectives, not just talk to them. You have to also shadow some people, go and observe the kind of work they are doing, the kind of interactions they get with patients, the kind of patient inflow they have. If you don't know any doctors personally, so then this is an important step for you, because you will need an idea of how this branch works outside of your UG college and outside of any government college, because you're probably not going to be in the government setup forever, for life. So you need to get an idea of how it is and how things are outside of this setup. Lastly, but most importantly, you need to figure out your priorities for life. I know this sounds like a very big thing to say and a very dramatic thing to say. What I mean by that, okay, you figured out what kind of a branch you want, found out what kind of a college you're getting. Few years down the line, you might find yourself thinking that this is not the life I imagined for myself. This is not the kind of lifestyle I wanted to lead. That is going to be the most devastating thing if you make a decision right now and regret it years later. That was my biggest fear. Like right now, at barely 24 years of age, I'll make a decision which will affect me for the rest of my life. That's why I sat myself down and I asked myself, what kind of a life do you imagine yourself living? And that kind of answered my questions for me. In my family, my father and my brother are doctors and they are both OBGYNs, and I have seen the kind of stress OBGYN puts you through. Not ideal, I would say. Anything that is primarily involved in patient care and in life and death situations is going to put you through some constant stress all the time. Cortisol levels are always going to be slightly high. I did not want that kind of a lifestyle for myself and made the branch decision even easier for me.
Hello, quick pop-in from Editing Zui to make it clear that I don't want this to sound like I'm bragging, because while it does sound like that, I just want to make it clear that this is very much the kind of dilemma I was going through right before counselling. And of course, your rank and the kind of college you're getting for that respective branch which you are considering, all these factors are of course going to affect your decision, and there's no doubt about that. What I am trying to emphasize from whatever I was saying right now is that no matter what branch you're looking at, every branch is going to have a slightly different lifestyle compared to all the other ones which you are considering. So prioritize what kind of a lifestyle you want and apply that to each of the branch which you're considering. That is going to help you make a wiser choice, which is going to leave you the least amount of regrets possible, because let's face it, you're always going to have regrets with everything. We just have to aim for least amount of regrets possible in life later on.
Truth is, we will always regret something or the other. Like no matter what choice you make, you'll regret it. I was regretting taking radio in the first few months of my residency, when I was looking at medicine residents being so cool. Like they were just so well versed in managing a patient, and they just knew everything that was needed to be done whenever a patient collapses or a patient suddenly deteriorates. They are over there, they just know what is to be done. That is so cool. And I was thinking that I'm pretty lame that way. I don't know basic patient care and basic patient management. I wish I had taken medicine. I wish I was as cool as these people here. But they are also regretting taking up medicine. Really hectic. They have not slept in 2 days. They have not had the time to eat. They have not had the time to shower. They are regretting their decisions. Everybody is regretting their decision at some point or the other. You just have to make a choice which will make you regret things the least. That is the motto for branch selection. You have to make a choice which will put you through least amount of regrets. I want you to consider all these factors when you are selecting your branch, when you're making a decision. That is so very important. And I know that our results are also responsible for affecting what choice we end up making ultimately. During my preparation year, I was expecting a rank of around like in the range of 500 to 2000. I was pretty sure that in this range I will either be going for medicine or pediatrics. I was aiming for radiology, but somewhere in my heart I always thought that I'll be getting a rank just good enough for medicine and pediatrics. I just knew that I would not want a surgical branch whatsoever. So even if I did not get a good enough rank, I would have gone for DNB medicine or DNB pediatrics, but I never would have taken a surgical branch. But because I got such a good rank and it gave me the option of getting radiology in a government college, that's why I went ahead and took it up. Maybe if I had a borderline rank where government radiology was not possible, then I would have taken up medicine in a government college. I was not so hell bent upon taking radio, whereas I know some of my batchmates and some of my seniors who were so certain that they wanted radiology, they would have taken it whether in TNB, whether in private, they would have taken up radiology anywhere. What I want to say is your results are also going to affect your choice making, and that is completely fine. In the end, what is going to matter is that you have made your decision and you are the one who has to stick with it through 3 years of residency. You should not have anybody else make the decision for you, because you'll find yourself blaming that person when things get really tough in residency, and it's not a cool place to be in when you're in first year and you are feeling horrible about everything in general. You should ideally not have anybody else to blame but yourself, because you are making this choice and you are responsible for it. So don't let anyone else make this decision for you. Look at your options, you look at your rank, you look at the kind of colleges you're getting, you speak to people from those colleges, you find out whether the course which you want is good enough there, how is the department, how is the faculty when it comes to teaching, how are the academic activities, what kind of exposure you get, hostels and stay and food, that is all secondary. Of course it matters, but that is all secondary and it can be managed at your own level. You can make changes which will improve these factors, but you can't change the kind of patient load that you're getting after you make a choice for a college. Make a well-informed decision, and hopefully that decision making time is going to come soon, because I'm about to start my 14th month of my first year of residency. Like, we are all just very done. Make your choices, make them fast. Come join as first years, the new bakras. Come join as our juniors pretty soon. All jokes aside, I hope you guys make an intelligent decision, a well-informed decision, and I hope that you get the branch which you want in the college which you want. If not, then I hope you get the best thing possible which will make you happy at the end of first year, just the way I am. Thank you so much for watching. Sorry for the long gap between the last video and this one. As mentioned earlier, things are hectic and I am not finding enough time to film. I'll see you guys in the next video, hopefully as a second year resident by then. Thank you for watching. Subscribe to the channel. I'll see you guys in the next one. Bye.